Hi,
Okay.
Bahar. I'm so excited to meet with you today. A good friend of mine, Mike, did a face reading with you, and I was fascinated by it. Now I want to try it.
Yeah. Well, Gina, thank you so much for giving me the chance here because, I get so many patients in your age group that come out to me and they have almost identical laundry list of symptoms. And every time I look at their face, before even I have talked to them about it, I tell them half of those symptoms and they're shocked to see how much I know just looking at their face. I'm guessing that's probably was fascinating to you.
Yes, absolutely. I want to see the magic unfold in real time.
Yeah, well, the fact is, the first and most important thing I look at in the face is how the organs that tell your brain how to orient your head on top of your spine are communicating those information to your brain.
Mhm.
Like your eyes, your ears, even your teeth, the way your head is oriented, all that information is important. But there's certain information that overrides everything else. So the way that your eyes are communicating to the world, the eyes determine the final position of your head, believe it or not, for balance purpose. So if you were to
Interesting.
close your eyes and stand up, if you do not have that information, you'd be probably completely a different posture. So right up with it is your ears. So I'm looking at your ears and I see that your right ear is lower than your left ear. Now, is it lower in your skull or is lower because you're orienting your head in the lower position? So why is that important? Because the way you're holding your head right now to listen intently to me and being able to do other things. One of the things that you're doing right now, whether you consciously think about it or you don't, is breathing and getting blood to your brain and oxygen. So both of those two are happening, and the outcome of how you're sitting on the camera right now is how you can suffice all of those and sit in a place where you can level your eyes with the camera. So if I look at your ear and it's constantly on the lower end, that tells me that ear is the one that holds your, basically is helping you reference the ground underneath of you. And I'm looking at your face also, and I see that your lower jaw is going towards that way too. So for those two information are adding for me, which if I were to have open your mouth, your mouth is going to shift towards your right side as well. And that's usually, not all the time, I have to look at further metrics, is usually the side of the body that you probably have issues with, meaning that there's a pelvis problem, there's a knee problem, there's a hip problem, something else is going wrong in there as well. Is that something that you can relate to, that you can speak about? Do you have any orthopedic issues that happening on that side of your body?
Yes, actually. I had knee problems a few years ago. I used to be a pretty consistent runner, and I had not enough maybe tissue in my knee. So running too often would make it flare up and make it kind of hard to walk. I don't know if this would suffice, but I have ear piercings on both ears, and up here I have like this one always gets infected on the side. I don't know if that
Which is,
constitutes.
when we have infections, it's lymphatic tissue that's not quite draining, which is really interesting because the way the body has organized itself, there's a switch system that takes away pretty much things that should not be in there, foreign pathogens, things like that. This is called the lymphatic system. And lymphatic system drainage is depending on movement, and one of the most basic movements that aids with that is our diaphragmatic breathing. Isn't that interesting?
That
One
is.
of the functions of our diaphragm is to move lymphatics. I mean, breathing is our switch system mechanism. That's correct. So if your breathing is dysfunctional, if your body's diaphragm mechanics from asymmetry of your body, which basically results in asymmetry of your face, is not working. Face, look at the skull back there. You see that? The skull, the front of our face, is byproduct of what's behind the face, which is what I call it, the rock that holds our brain. So the brain and the cerebellum and everything is in the back, and our face is in the front. So if you think about it, neither one of them are done growing at birth, but they all grow in different directions as we grow, as we learn to walk. As I
Mhm.
always say, as it is above, so it is below. Our faces reflect they basically go in different opposite directions according to how we respond to functions like as walking, breathing, moving fluids around our body, and that aids with the movement of lymphatics, of blood flow, CSF fluid to our brain, which is a dedicated system to supply, oxygen to the brain. So you see how important it is to have orthopedic structures as working cohesive and in order to make that happen. Well, what happens if they are not in order? If they are not, in fact, in where they're supposed to be? Something is not working. There's a blockage somewhere in the flow of everything: oxygen flow, blood flow, lymphatics flow, spinal fluid to the brain, return of the venous drainage, which is deoxygenated brain, vagus nerve function, all of them get impacted. So, what is
Mm.
downstream from that? Symptoms: brain fog, fatigue, digestive issue, hormone imbalance. Look, what people perceive of our faces and our mouth, the lower jaw, look, if I hold this lower jaw in my hand, without the magnets on the teeth, it really cannot be a part of the rest of the skull. You see that? It's just
Yeah.
so the only time this becomes a part of our system is when the magnets on the teeth holds it together. So I'm going to put the mandible for the time being apart. And this is your face that I look at. Your eyes, your upper jaw, which is the biggest part of your smile, and the bones on the side that holds our TMJ, which is our mouth. Now, why is this super important to me, Gina? Why am I even taking the time to tell you about it? Because these two bones hold your ears, and your ears are the balance center, and the way you're holding your head is representation of how these two are overriding every information to hold your head in a way that you can balance yourself in 3 dimension, right?
Mhm. Yeah.
And when these two are off, one is higher, one is lower, one is back, contorted for one reason or another, this will directly impact the flow of the spinal fluid, the irrigation system around the brain. Most young patients are starting to understand and hear this term. They think, what does that mean? Just understand that the lymphatic system removes toxins from your brain. And I'm not talking about external toxins. I'm just talking about like metabolic stuff. If
Yeah.
you do not take your trash can every week on Fridays and put it in your driveway, the city or your HOA people come in and pick it up and take those garbage away. It's a good thing. What happens if either you don't take the garbage can from your kitchen, put it in the driveway, or they don't come and pick it up? One or the other two, it's going to cause some problems, like some
Yeah.
stinkiness around. And if that
Mm.
keeps on going for a while, you could only imagine the cruds that can accumulate in your garbage can. It's a
Yeah.
really rough example to show you why the irrigation system and the whole process is important for the brain, because body, you will be producing metabolic waste. Just breathing and functioning, brain is a very active organ, uses a lot of glucose, and metabolic waste that comes up, they need to be removed. And the mechanics that help remove it depend on the meningeal system that's anchored to the side of the skull, to those temporal bones, from the top attached to the base of the skull, right on top of the nose, and on the back to the back here, where your skull is supported on your head, and from there it drops down to your tailbone. So if there's any asymmetry in your body, your pelvic orientation, your shoulder, your head, your ears, I could bet the irrigation system isn't working. So the
Yeah.
trash can guy cannot easily come in and remove your trash easily, right? That example, or the flushing in your toilet. If you don't flush it all the way, what's going to happen? Either it doesn't completely flush or flush halfway through. Just imagine that. What happens to the brain? The backed up metabolic waste can cause damage to the brain. Now, you know what happens when you sleep, Gina? When you sleep, your
Mhm.
brain goes into the slower wave called delta, that juicy sleep that we need for restorative homeostasis. Part of that delta sleep is the brain kind of amplifies or increases the CSF, the fluid around it, so that it can kind of soak all those, metabolic shells, metabolic waste. They kind of like leach them out of the brain, dump them into that sewage system, like the garbage guy that come in and just remove them from lymphatics. When your brain has already been suffering from lack of proper flow, and there are parts of it that doesn't flow properly, when the brain is ready to go from delta sleep to, sorry, theta sleep, which is before getting into deep sleep, to transition into deep sleep, those checklists are not checking off. Kind of like an airplane. When an airplane is trying to take off, they have a long list that pilots have to go through. If any of those safety factors are not checked, the airplane can't take off. That's
Yeah.
what happens with a lot of folks that cannot get deep sleep, restorative sleep, and all of those amazing homeostatic is not happening to them. But also, traumatic events like PTSD and childhood trauma can do that. Metabolic disorders, hormonal imbalance, leaky gut, and lack of proper supplementations, minerals, that all can signal the brain into we're kind of not safe to go into this stage of sleep. We need to. And when you're not getting to delta, all the amazing good things that happens in that deep stage doesn't happen. So when I look at someone with the, this disruptions, the first thing I want to know is, how are you breathing when you're sitting in front of me? Because if you're not properly breathing during the day, it's just a matter of time. You go to bed and you're going to carry all of that with you. So if
Yeah.
I were to list a few symptoms, other than the injuries orthopedic that I would expect, I would say maybe TMJ locking that you would experience, or deviation, or to some degree clenching and muscle soreness in your face, like right here on the side. You see how you have prominent, really prominent masseter muscles? Clenching is the number one.
Yeah. I definitely, in my sleep, I do clench my teeth. And then when I smile a lot, I'm a very smiley, bubbly person. Sometimes when I smile too much, my face will hurt.
Yes, because you know what it takes. This is called a bowling ball theory. Believe it or not, our head weighs as much as a bowling ball.
Oh,
Really, 12-pound medicine ball or bowling ball.
mhm.
So imagine if you were to hold a bowling ball right here, or
Yeah.
for all day, like throughout the day. You
My muscles would be gigantic.
Yeah, and sore too,
Yes.
right? So fact of the matter is that's a compromised position you have to attain, because there's three things that you have to do when you stand up. First of all, you got to breathe. You got to be
Yeah.
able to breathe and respire and get stuff to your brain. Balance your eyes and your ears and all your senses to the horizon, just so your head doesn't fall forward.
Yeah.
So if you take a compensation for both of those two, for balancing yourself, now your body is like so sore and tired. And that's a compensation, right? First of all, it taxes your nervous system. It's just draining your energy, making
Mhm.
your muscles tired and working overdrive. But also when you go to bed, you cannot attain that position here, because gravity works with you here, but not here.
Yeah.
You're struggling. One of the reasons, Gina, I see patients clench and grind, and when I look at their faces, I see their muscles are really just overworked and large, like there's large muscles here, or neck muscles too, as I see the way that you're shifting your head. One side, to be exact, the right side is much tense, and I see that your shoulders are also rounded. All those muscles that are helping you to attain that posture are to be called type 1 muscles. They are postural muscles. They're not automated muscles. The clenching and grinding I see is one of the ways that we actually bypass some of those blockages in the spinal fluid. It's actually been linked to a lot of reflexes that kick in an attempt to make sure the fluids get around the brain, oxygen gets delivered to the brain, that you don't suffocate. It becomes, instead of sleeping and gaining advantage of a restorative sleep, that creates anxiety for our brain. A lot of folks avoid bedtime. They don't know why. They go to bed, they lay awake with their eyes open. They're like, why am I not falling asleep? Because brain perception of safety is in danger. And it's
Mm.
all written all over the face and the posture. When I look at folks that, their faces are asymmetrical or narrow, tall, or short, and the dimensions are not right, I know the neutral mechanics that are supposed to be in place to support your head without compensation, without effort on top of your spine, making sure your diaphragm can fully expand and contract to move air in and out of you, move lymphatics, move your organs for digestions. All those amazing homeostatics are compromised. So when I look at them, I would say I would expect you to have some degree of hormonal dysfunction. Fatigue is the number one. Chronic fatigue syndrome can get through the day. I don't feel like waking up fresh, ready to take on life. And I have digestive issues and I don't know what to do about it, because if your digestive system is not functioning, you cannot digest certain foods, and your body's in inflammatory fight or flight constantly, that impacts your neurology and homeostatics in biomechanical part of your health so much. So what can we do about it? Because a lot of folks listening to you maybe say, oh my gosh, that's me. What do I do? First of all, that is not normal for you not to be able to support your head in a proper posture. Rounded shoulders, head tilting, that is not normal. Clicking jaw joint, not normal. Mouth breathing, not normal. So those are not normal things. To just understand and acknowledge them as one. And it's not something that goes away, by the way.
Mhm.
Fatigue every day, it's absolutely not normal. Depression and anxiety. And if you have two out of this list that I said, even if you have two of them, they're all interlinked to one thing: malaligned orthopedic impediment on brain clearing itself, getting food, oxygen, removing waste, and proper functioning of the brain itself, which pushes your nerve back. Well, we gotta orient these bones in the proper order in relation to this, which is the work of a good, well-trained dentist like me, working with a group of physical therapists, functional medicine doctor, MDs that are able to put together the body top to bottom, bottom to top together, to retrain the brain how to properly breathe, how to properly respire, how to properly put the tongue at the roof and close the whole system in a way that you can use only your nose to breathe, only 6 to 10 breaths a minute. And I'm saying 6 to 10 breaths a minute because some folks say, well, the numbers of breath per minute is 20. I've heard that too. It's almost like Gina saying that it's okay to be 500 pounds overweight and needing 6,000 calories a day to maintain it. Neither one of them is healthy, right?
Yeah.
And folks that are living in a state of 20 breaths a minute with anxiety, that's not normal. Like check in with your breath. If you feel like you take a deep breath and your shoulders rise, that means you're constantly just trying to catch up with that next breath and sympathetically doing so. That is the number one thing. And what would I do for a patient like you? I mean, I take some very sophisticated testing, like CT scan of your head. I would evaluate your posture, and I would work and see, in a chiropractor maybe that knows how to align your spine and align your mouth and your tongue to the rest of the structure so that you can control the way your face and the body are correlating to each other for the most important function you have to do, no matter what else you do. Breathing. It's
Yeah.
the number one thing you have to do.
That's fascinating. I think I definitely breathe more than 6 to 10 times per minute. And breathing is something that you do subconsciously. So you don't actively think about how you're breathing or these these pieces of your posture. It just happens. So it's bringing awareness to the way you move through the world is how you start to fix it.
Exactly. Like you said it, we come to this world as an infant. We were in the womb, we were an amphibian. We didn't have air in our lung. The minute we were born, we have air in our lungs. We breathe in and we have to breathe out. And the way we breathe is with barometric pressure. Breathing is just pressure change inside and outside of us for a variety of reasons. The most important is moving air in and out of us. And the first breath we take in is accompanied by movement of our lung and diaphragm, and for the brain to get that oxygen, the movement of the reciprocal tension membrane, which is the dura meningeal moving the spinal fluid, and the nervous system is dialed directly to our breath. Nervous system tells you at any given second what you're doing, kind of like the stock market. There are
Hmm.
major indices that when we open up our app and taking a look at the stock market, we'll look at reds and greens, right? Like NASDAQ or S&P 500, they tell us what the market is doing, not individual stocks, but when we're looking at the state of nervous system as far as economics, we look at the red, we're like, well, that's sympathetic. Okay, what are the things that impacted those reds? Pretty much like a system in our body. Our bodies are designed to control itself through the autonomic nervous system, which basically automates functions that we shouldn't be thinking about. You don't think about your digestions. You don't think about when you eat food that you have to secrete hormone or enzymes to digest your food. You shouldn't think about your breathing either. You should
Yeah.
not need to use muscles that are controlled by your frontal cortex to breathe either. But why are we doing that? Because of the compensations we have to assume. And if you think about it, your posture automates that to a point. Body is always looking for automation to be the least costly. Frontal cortex is very costly. You have to constantly think about it's costly. What can we automate? And if it's really not able to automate it with the cheapest way possible, it will do so with the most expensive way possible.
Mm.
Drains your nervous system. Being in a sympathetic overdrive is very costly to the body. And every time that your body is operating out of that branch of nervous system, you have digestive problems, you have hormone problems because it's a stress. It basically is conducive of stress hormones in the body. You know, anxiety is a byproduct of body and survival. And if I could just get to the ears of every youngster patient that think that, oh, I just have anxiety, I have to be on medications. If I could tell them, But do you breathe right? Is your body postured properly for proper breathing? Are you able to get a good night of sleep? Is your brain feeling safe? Is your digestive tract working for you, or is it under attack? Then you would just see a laundry list of symptoms would disappear.
Yeah.
And above that all, you're able to actually enjoy life experiences. And I see the voltage in young patients' eyes when they're not able to do all of those. Like their bodies are just drained and they're just barely living. It's not quality life. They're not able to put their best foot forward. They're not able to live the fullest potential they have, to set goals and hit it because they're physically unable to get there. I want to set goals for the next 10 years. I want to do better with my life. But gosh, if I had a little bit more energy, do you hear that ever? If I had just a little bit more energy, well, guess where
Yeah.
that energy is going? Energy is going towards breathing that should not cost you nearly as much as it does. How
This
can I?
is so fascinating because I definitely do feel fatigue. I'd say most days, midday, I kind of start to feel tired and I'm fit and I'm young and there really on paper should be no reason why I feel that way, but it's probably because of my breath. I wonder too, I do have asthma. I don't know if that plays a role in all of this.
You know what? Breathing disorder, pretty much COPD, asthma, obstructive sleep apnea, snoring, all of them are breathing disorders. And a disorder meaning that outside of the way it was supposed to be. Actually, I've had treated so many patients with asthma. And the reason why we have asthmatic attack is because the proper way of breathing from the nose is not possible for the body. And when you're breathing through your mouth, all the allergens, all the pollutants in the air, instead of getting filtered through the nose, they go directly into the lungs.
Mm.
So, could we really argue and say that asthma is just inflammation in the lung and it's a smooth muscle of the lung that's not properly functioning? I could tell you, if you only have an asthma attack when you're exercising, like induced by exercise, this is a problem with breathing. It's not necessary. I mean, the label is a label, but I could tell you, I've treated so many patients and focus on getting them nasal breathing, and they don't need albuterol at all. They don't carry it anymore because they never have another. So to answer your question, yes, the focus, I don't put focus on labels of medicine and disease. I put my focus on restoring your breath because if your breath is proper, to put the focus on your breath is to put the focus on your longevity, which means somehow all these labels will start dropping. ADHD, chronic fatigue, obstructive sleep apnea. I am actually a pleasant person to be around. I have more energy to deal with life struggles. I have more resilience. Those are terms that I can relate to and people can relate to. And can I say that I want to treat your asthma? I think by getting you breathe better, asthma will be in the rear view mirror, whatever you want to call it. Would
So
that be
what can I do to start? So what action can I take by myself day to day to start breathing better, to start having more energy?
Yes, the first step for anyone is, are you breathing properly through your nose? Yes or no? When you're awake. If the answer is no, meaning slow breathing, not rising your chest and shoulders, but with the proper posture, with the proper diaphragm activation, are you able to sustain a normal 6 to 8 breath a minute, which means your physiology, retaining the CO2 buildup, chemistry of the brain, not just, the rest of your body, because that's the most important organ. Can they all suffice and sustain slow 6 to 8 really breath per minute, 4 seconds in, 4 seconds out? That should be the norm. The answer is no. Now I'm going to become the detective, Gina. Why? Because if you think about it, any number of these three things I'm going to name could impact the rate of your breath. Your orthopedic structure, which means the space behind your tongue, the structure of your nose and face, and how you get the air in, the structure of your posture, shoulders, pelvis, diaphragm, and all of them come into account to make sure that happens. On top of the structures in your head, the orientation of your face, your eyes, ears, all of them combined called orthopedic alignment. Are you orthopedically able to get this breath in a slow manner? No. I have a narrow nose, I have a deviated septum, I have a really tiny mouth, my tongue doesn't fit my mouth, I have to push my head forward, my shoulders get round, my lumbar spine is all curved, and my entire face is crooked. So which by the way induces septum deviation, cricket face epidemic. And no, I can't. So that's the orthopedic cause. Then I'm going to ask a question about the physiology, hormonally, thyroid, HPA, cortisol, gut, because a lot of enzyme hormones that we need all produced in the gut, are they all up to par? Or are you in a sympathetic overdrive from there? If the answer is no to that, then we have to investigate that too. And the third and the most important that much people don't talk about is the mental health aspect. Because if you think about it, if you've had unresolved childhood trauma or PTSD, which some people do, that can put you in a chronic state of anxiety. And what happens if you hear bad news? The anxiety induces chemical reaction in your body. Your heart rate goes up. You start panicking, breathing, just from thought process. So unresolved emotions in that part of our limbic lobe and hippocampus can as much impact our breathing as having a narrow nostril and a small
Mhm.
mouth. You see that?
Yeah,
So
it's so holistic. It encompasses
exactly.
everything. Yeah.
It's with the full acknowledgement that as a human, we have three aspects to our being. We have physical health, we have chemical health, and we have mental health. Panic breathing is lack of safety. And when we're trying to transition, when our circadian rhythm kicks in, light and dark is the number one factor for the circadian rhythm called process C that prepares our body physiologically for sleep, basically kind of dialing down on our physiology, kind of preparing our body for slowing down so that the brain can do what it needs to do to clear homeostatic functions, what have you. All that happens from the time melatonin kicks in. So yes, youngsters out there staying in front of your phones and TVs and what have you, is going to signal your brain that we're nowhere near ready for the bed, okay? Even though you have
Yeah.
the pressure to sleep, because the brain is like, we kind of have to dump this garbage from the brain, right? We need the delta. But it's not happening because the brain is like, well, as far as I'm concerned, it's still daylight out there. So both of them work together. But when we kind of kick into that homeostatic part of the sleep, the delta, before the brain transition you from going from like what you and I are right now, we're in a delta wave, but sorry, beta. Beta is when we're functioning, like when you're using a knife to cut something, your brain is in beta functioning. Alpha
Mhm.
is that meditative state. Theta is that rapid eye movement, the dream stage in sleep, unstable sleep, almost close to awake. Delta is when the brain and body dissociate. Like the brain is completely slow wave. There's no thinking process. That's when the brain kind of gets a chance to increase the spinal fluid, kind of like washing machine that soaks the clothes before it kind of squeezes them to get the toxins out of the brain. And we definitely need the delta wave. If we do not get enough delta sleep, which should be about 60% of the architect of our sleep, our brain is not going to do its job of cleaning the toxins and making new space for learning and functioning. And that leads to Alzheimer, dementia, cognitive behaviors in children, ADHD, basically the brain that is not able to, the synapses that are forming in a growing child, and all that stuff happens in delta. So before we transition from theta to delta, a lot of checklists has to happen. And breathing
Mhm.
is number one. This
Is
is
there a
function.
way to measure while you're sleeping how long you're in theta and how long you're in delta?
Actually, you're so smart. I love you, Gina. You're just asking so many great questions. I
Thank
love
you.
it. Yes, you younger
So
generations, you
curious.
guys
This
are.
is so interesting.
This is really good. And you know what's really cool is, like older like generations before me, they trusted doctors and never asked questions. When a doctor says this is your diagnosis, they take it and they go, what do I need to do? You guys ask questions. I love it. You're like,
Yeah.
no, I want to get to know my body, which is why I am able to do holistic treatment. And most of my patients, believe it or not, they're between 80 to 40. 18 to 40, sorry. 18 to 14 years, 40 years old. They are interested in holistic health. They want to know how their body functions. They don't want to operate on it. So
Yeah.
I dial you in, putting cuffs, like pressure cuffs around the ankles, hands, and then some patch on the foot, which basically measures the sweat gland functions because sweat glands respond to like sympathetic overdrive. So we actually can measure and see in your state right now, how's your nervous system, how's your voltage, and we can measure with the brain, like we see what part of the brain has brain waves, and we have you close your eyes and we look at the parts of the brain lobes that are dominating in one phase and the other, because you're right, if your face is contorted, which means your cranium that holds your brain is contorted, and the sewage system is out of whack and is not draining, especially that your breath is not helping the pump that's supposed to be basically flushing it is not working, and your tongue is a part of that, by the way, to kind of flush the brain, there's a part of the brain that is just not getting enough drainage. It just builds a fluid, and that part of the brain is not able to produce proper brain waves. A lot of folks that have ADHD symptoms is because no two parts of their brain are singing to the same music sheet. You know, imagine like, oh, there's all kinds of noise in there. And it's just because the brain isn't able to clear itself. It's just transitioning to brain waves and getting cohesiveness and resonance between all different parts of the brain to function. You know, part of our brain is responsible for our balance, getting information from sensory, proprioception, perceiving safety, scanning the environment, basically, the reticular part of our brain, scanning the environment for information, filtering it out. Because you know how much information is coming at us at any given second? So the brain has a really efficient system to dials it. And it only screens for one thing, safety. So it's important for the brain to scan for safety, and safety to the brain is what it knows. What it doesn't
Mhm.
know is what it knows, even if it's dysfunction. So sometimes we're so deep into our dysfunctions, whether it being mental, whether it being orthopedic, that snapping out of it takes a team
Mhm.
and an approach that is all body, because we're working with a living system, a regulating living system. And when I see malalignment, I know malalignment. This is why I constantly say your diagnosis is written all over your face. And that's the name of my podcast. If your mouth could talk, would tell me about all your dysfunctions, because your mouth is a product of your face and your cranium. And if they're out of alignment, it literally shows up in your mouth. And if I just look at your mouth, I could tell that your body's not fully functioning in a state of homeostatic. Or if you're symptom free, you have a way to compensate. That is, the cost is not affecting you, meaning that you're paying a huge due, but you're unbreakable until you're 40. And at 40 years old, things will start to decline. We're getting more oxidative stress from the environment. Our genes are not producing good collagen, right? So our poor posture could withstand itself because we're making good collagen that, you know, basically replaces our, you know, joints and what have you. When you're 40 years old, our bets are off, especially for females. We hit menopause, man, perimenopausal bodies start to kind of like hormones are off. The inflammation is now taking a different toll on the body in perimenopause and postmenopause than it did before. So now we're seeing new symptoms emerging. We're seeing more Hashimoto's in women postmenopausal, because that's just body sympathetic overdrive that turned into autoimmunity in age where hormone is just no longer functioning at optimal. And if you're not doing something for this younger generation, especially in child rearing, during the child rearing years, moms and perimenopausal, we're just constantly grinding our bodies through life, and we don't know it because we're just ambitious to get through life. Oh, I didn't get
Yeah.
a good night of sleep. It's been years when I've had a good night of sleep, but I want to crank through it. What do they say? Grind through it. There's no grind.
Yeah.
There's no
It's like that
grind.
toxic productivity.
That's exactly what it is. That's exactly what it is. You only get one body, you only
Mhm.
get one set of teeth, and nothing can replace it. So think about the price that you're paying,
Yeah.
and, anxiety, clenching, headaches, fatigue, breathing disorder, digestive issues, mental health. Just understand that they all are connected. So when I look at the big picture, the first thing I would say we need to do, I love this example I always give, wet floors in a kitchen. If I see your wet floors, if your floors are wet and have been wet for a while, like 40 years, now I see the wood floors coming unglued. But does it make sense to replace the wood floors? You'd be like, you know what? Let's just take care of the water first. But I'm going to ask another question. Where's the water coming from? I see a sink overflowing to the
Mhm.
floors. Okay, your sink is needs to be drained. Somewhere in
Mhm.
there, you're stuck. Okay, that's a good step in the right direction. But real source is that faucet that need to be turned off. But either way, if you have a plugged sink, it's just a matter of time before it overflows, no matter how big the sink. At some point, it will overflow if you don't shut down the faucet and drain it. That's where I look, while most of the medicine is focused on replacing the floors that are breaking down and mopping it. That is unfortunately an allopathic, silo-driven medicine. That's where they look. And holistic medicine is just not farther than just let's go ahead and increase the size of the sink at best, but draining is what I'm after. And that's where the orthopedic comes in for me. That's where the nervous system comes in for me. And that's where I look and seeing what's causing that faucet to drain, that sympathetic overdrive, those inflammatory markers that are running into your system. What's triggering it? Is it mental trauma? Is it physical trauma? Or is it nutritional trauma? Any number of those can cause that, cause inflammation, cause cycle of body state of sympathetic overdrive. And the telltale of story is the same thing. You know, it's no different, than getting a destruction from a fire or a firefighter hosing your house. They're both going to cause destruction for different reasons.
So why do you think when I go to the doctor, my doctor never tells me any of these things?
I love this question, Gina, and I want to answer it in a politically correct kind of way.
Hmm.
The reason why doctors don't tell you that is because doctors are trained to look at one thing, their own specialty area.
Yeah.
Medicine has been segmented into different specialties. I was a dentist. My DDS training tells me I have to look at teeth. There's 32 teeth and the gum tissue that is responsible for holding them in the mouth, and you're responsible for that part. I did not get training around the tongue posture, although it was sitting in the middle of the teeth. I didn't get much training at all about the structure of the neck and jaw joint that holds it all together. So, because I didn't get training, that's what our allopathic mainstream medicine is. And medicine trains on certain areas. If you're a cardiologist, you look at the heart and the metrics that are associated with that. If you're a sleep doctor, you look at metrics of the sleep. But then these two don't talk to each other. Like we're in a 16-lane highway, but we're not taught to use our blinkers and side mirrors. But in a body, it doesn't matter. When a patient comes to see me, they're not just a set of teeth. The fact is, we get training as if body works in isolation, and it never does. We take the mainstream training, took the body as a system, separated it into pieces, and put specialties in charge of them as if they don't talk to each other. So medical doctors are not trained to ask about what's happening in your mouth. Chiropractors are not getting training about what's happening in your mouth. Dentists don't get training about what's happening in your neck. How is your depression related to your malocclusion? Or your digestive issues are related to your tongue posture, or the way you breathe, or your way you sleep? We didn't learn that. That's not a part of it. So we can't blame the doctors because it's not a part of their training. But I
Yeah.
am holding everyone accountable for not learning anything past. And that's sort of why I'm passionate about putting this information out there for not just lay patients, but also for professionals that are not trained about the whole body. Because only time that I was able to get patients' symptoms all at once drop. We have a documentary coming up called The First Symptom. I'm very proud of it. It's accumulation of some of my best patients I've treated, some of which traveled the world to come see me. And they had been, one of them in particular, for 10 years, have had a laundry list of symptoms from physiology to orthopedic, from pain to sleep to depression to digestion, all of it. For 10 years, went from one doctor to another, sought some of the best providers in the world. He spent close to $500,000 and got nowhere until we looked at him as a head to toe. We addressed things in the right order. Within 3 months, his body started to unwind and his symptoms to start to drop. Within a year, he's a completely different person. And I asked that same question. Why does it take a decade lost? Why does it take hundreds and thousands of dollars? And what else could he do in 10 years? Some people never get an answer for 50 years. And I see them after 10 illegitimate surgery and lost potential. They haven't had quality time with their family. They haven't had quality time with their loved ones. They haven't experienced enjoyable experiences in life because their bodies aren't keeping up with them. They haven't set goals beyond just survival because how could I? I can't even travel without so many accommodations because my body's not self-sustaining. And all the while we're told a lie. That managing disease is the new state of health.
Yeah.
Medications can keep you healthy. Medications only kill symptoms. It never meant to make you healthy. And I think one area where I'm so passionate about is healing and body regulating itself, and is perfectly capable of doing it. So I have treated some of the sickest people that have been genetically disadvantaged, and they have been subjected to so many irreversible procedures, surgical procedures. At age 68, I'm treating him and I'm still able to help him. If I could do it for him, I could do it for patients like you in a heartbeat, but it takes a team of being, two people, yet could come from a completely different source. So this was a winded answer to her question. Why
That's an
is it that your
important
doctor doesn't ask the
question.
question? He doesn't know how to ask the question. It's not a part of their training. And they only have 15 minutes with you. In 15 minutes, I can only review your vitals. And until the vitals start to drop, which means you're now in a completely different stage, you're not just signs, you are symptomatic. There's nothing I can do for it. I have a bunch of codes. And if you don't fit into my codes, you're good as far as I'm concerned until there's a meme. I love it. It shows a doctor coming to a patient's funeral with the lab results going, your blood works are normal.
That's hilarious.
Read that again. Another good one, the Camel, the cigar, uh,
Yeah.
the Camel, the brand of cigarette, nicotine, back in 1930s, I believe. I just pulled up the ads off the internet, and this was what the ad read. It's way beyond your age and mine. Camel is the brand that doctors smoke. Doctors smoke Camel more than any other brand of cigarette. Isn't that horrific when you hear that this, right? The
Crazy. It's
question you
so crazy.
asked, the question you ask, maybe you have a better answer 100 years from now. But I'm not patient for that at
Mhm.
all. I want to live in a world where humans have their full potential to live like humans and do life to the fullest. And I just love how the potential that your generation has. I've worked with you so long. You're just so smart. You guys are so smart and have so much potential. And it hurts me to my core to see that by 4 o'clock, you're just already are spent because you spend most of your energy. It's like you haven't charged your battery at night, like your cell phone. You haven't charged, it hasn't charged you. It was plugged to the wall for 8 hours. The sleep, that's what it is. The sleep is putting your body in charge to charge for the rest of the day. But when there's a hardware or a software issue and it doesn't charge in that 8 hour, you pick it up and it says 40% charge. It only gets to 2 o'clock in the afternoon unless you plug it to some sort of an external, battery. Like most people take like supplements, they
Coffee.
can peel coffee, they go into strenuous workout, which breaks them down even more, like martial arts and running. Why?
Yeah.
Because they need that dopamine. They need that hormone to get them through the day. They do things that's detrimental to them. They go to food, they overeat because when your body's in a survival mode, meaning you haven't had a good night of sleep, your brain only interpret that as one thing. We're in survival. We're going to starve. So I need to eat more and more carb and fatty food so I can store energy. That's why we have so much, weight gain associated with all this high cortisol drive and lack of sleep and
Yeah.
anxiety. And in anxiety, our perception, our primitive brain has only one perception. I'm not safe. I'm going to have to store things. And it becomes a huge problem for weight loss, for mental health, for sleep initiation, sleep maintenance, which becomes the vicious cycle that never goes away. One feeds to another until we come along and say, you're crooked and your body is out of alignment. And out of alignment, it cannot establish itself. And at some point, your body neuroplastically will adapt to this and it becomes harder to treat. So your case is super easy to treat, as a matter of fact. It takes 2 or 3 providers and a good proper diagnostics and a commitment. More than anything, doing things the right way. I don't believe in pills. And right now, there's a pill for everything. Everything you take a pill, and we can get you to 30 pounds loss, but we don't know what the side effect of those pills are.
Yeah.
I don't believe in pills. I don't
Mhm.
believe our bodies were meant to function on equipments and pills. Those are reserved for life-threatening situations. I don't think that mode of operation should be everyday health. And truly, health is resilience. And our focus is to store resilience so you have more to give to the world. So you're not spending it all just to breathe. Breath should be restorative, not destructive. Breath should not be sympathetic, should be parasympathetic, should encourage your vagal tone and social engagement, not to add to your anxiety. If I can find out what it is that your brain is doing to dial your breath to one branch or the other, I can definitely help you. And that should be
Mhm.
the only way we look at people. I don't believe in diagnosis, I believe in decompensating. So
Mhm.
I hope that this answer you liked because from this way I see the world, there's a ton of hope.
No, I love it. You're doing a wonderful thing. You're bridging a massive gap. And if all physicians looked at it from this lens, then everybody would be happier, healthier, would be able to contribute more of the special things that they have inside of them
Yeah.
towards their livelihood. So yeah, this is fascinating. I think the first thing I'm going to do when this call is over is time myself for a minute and see how many times I breathe, just to see, where I fall on that scale of
Yeah,
healthy
and you know what
breathing.
else? I mean, I'm just pinning you over here and I'm just trying to look at your face. And what I see is that your left eye is larger and higher. So you're left eye dominant. Are you also left-handed?
No, I'm actually right-handed.
So right-handed
But
with a
I
left.
will say, I don't know if this would answer, but I write very weird as like,
Okay, fun fact here. So basically, our brain does not have, your eyes are not seeing everything. Only 3% of the information is gathered from your eyes, and they kind of come in the optic chiasma, and the brain interprets the rest. So 3% is what eyes gather, the rest is what your brain put the perception from both eyes. So the dominant eyes is what kind of scans the environment for safety and all that. So left eye dominant, right hand, meaning that because most humans are left brain dominant, so left brain controls the right side. So the hand and the foot that is basically moving you through space for executing actions. So if you were to run, like stabilization, right foot is wired to the left brain. But in your case, left eye is the larger one. So the information that dominates is coming from the other side. This induces a condition called dyslexia. So skipping through the words when you read. I don't know if you relate to that, but most kids that are having difficulty reading through schools because their brain wiring, the side that's dominant with the organs that are controlling their executive functions and the eye are not reading the same information. And that conduces a lot of this. Like when I see patients that smile and their mouth slopes over here and they put their teeth together and it slopes here, there's a lot of discrepancy between interpretation of the eyes and mouth and ears and pretty much everything that goes into the brain. Isn't that funny?
yeah, that is so interesting. I personally don't have dyslexia. I have heard of it. I know what it is, but that is a really interesting connection.
Yeah. So the eye dominance, like I said, but the way you're holding your hand to write and everything, like I said, your brain that controls you is on the left. Most humans, again, 99% of humans, left brain dominant.
Mhm.
And, like the executive functions come from the left side, kind of like left and right together. They make the big picture. But for functioning, we are mostly geared on the right. We have more organs, foot is anchored on the right side, and which ear balances your foot also kind of gets into the mix, which is really making humans so beautifully complex.
Yeah.
I love it. They're complex and yet easy to understand if you look
Mhm.
at them as a whole system. You take it apart, that becomes hard.
Yeah, definitely. This is really fascinating. Thank you so much.
Yes, thank you.
Wow, this is so fascinating. Now there's so many different, when you don't know that things like this exist, you can't look into them and you can't strive to make them better. And I'm somebody who I'm really big on health, like mental health, physical health, spiritual health. I
Mhm.
do research on these types of things to try to make myself just function the best that I possibly can. And this is just a whole new can of worms that I can start researching.
And a human body is a temple where our spirit lives. Our soul and our spirit lives in this body. So I don't believe in operating on it. Matter of fact, one of the podcasts I want to do is it used to be healthy, not highly medicated, but then we changed it to,
Mhm.
and I love the title by the way, is there is no code for restoring homeostasis and get dive into the deep of it with medical doctors I work with functional health. Why is it that what you do is not properly, coded in ICD codes? Like when you go to a doctor, they ask you a bunch of questions about your symptoms. So if you just say I don't feel well, they like, well, there's no code for that. They have to have a code for subjective report from a patient. The closest thing they can say is fatigue and feeling lethargic, which means the state of acuteness, not chronic. That does not imply to a chronic state. And then they have to run some tests according to your symptoms, order some labs and imaging. They gather their objective information, marry that to your subjective, and say, well, it seems like you've got a kidney issue, or you have a liver issue, or you have a, thyroid issue, whatever. And then when they have that diagnostic called ICD code, now they have a code for treatment. So
Mhm.
we have a universal code of diagnostic driven by what the patient gave and what the doctor got. And then we have a diagnostic, and now we're going to treat you according to that. So there's coding. Literally, there's coding.
Yeah.
If I say that their malocclusion is a result of their cranial mandibular alignment, come from their pelvic malalignment and breathing dysfunction and their CSF malfunction, they're like, What are the codes for that? Besides, you're a dentist, you cannot use M codes. Those are not in your specialty. What?
Mhm.
So you're telling me a patient that comes to see me only have teeth and not bones and muscles? Yeah.
Yeah.
And then when I say, okay, I want to restore their homeostasis, what's the code for that? There is no code for that. Is that a procedure? Are you going to give them a drug? No. Are you going to put something in their mouth? No. Are you going to cut on them? No. Then you're just going to talk to them? Yeah. Okay, then you don't get paid. You see how I got broke? I got broke. And I did. No joke. I did go broke, which is
Mhm.
why I sold my practice. I'm like, I can't do this. Half the
Mhm.
patients that come to me and they want full mouth restorations, they're in no shape or form ready for a full mouth restoration. I could have been a millionaire, continue doing mainstream, or
But
get
you
out of
care.
it
You
and
care
scrape.
about your patient.
I couldn't live with myself, Gina. I literally, the best decision I've made was ditch the mainstream dentistry because it was consuming, non-productive for me, and it was not a fulfilling career because I wasn't helping nobody. I
I'm
wasn't
proud
helping.
of you.
And I
That's a
couldn't keep lying.
huge.
I couldn't keep lying. I did not want to lie anymore to them that, oh, this restoration is going to help you. It's like, I don't know where your gum disease is coming from. A steering wheel of a car is shaking is because everything in the car is out of alignment. And I can't just fix this. So I'm like, I guess I have to become a car mechanic now instead of being a tire shop. I was a tire shop. They come in because they wore the tires. The tires are worn out because when the car is out of alignment, the tires wear out.
Yeah.
And when the tires wear out, they come and see the tire shop. And I'm like, no, I think it's because of their alignment. And I think it's because of the steering wheel. That's TMJ locking and snoring, literally just the noise. And then
Yeah.
when I started to look into the suspensions and alignments and the whole car moving through space and everything, it's like now I have to be a chiropractor and a PT and a functional medicine doctor and a shrink and a psychologist. Like, and then
Yeah.
some.
That's
I'll
you're
take it.
superwoman.
I'll
You're
take it.
superwoman. I love it.